We want only one thing. We want the best healthcare system in the world for our patients at the best possible price. It can be, it will be achieved.
I'm a builder. I build big things, I do big projects, and this is about as big a project as healthcare is going to see in the first half of this century. There has to be a new highway to connect all these different moving parts out there, and nobody in the world has built a network like this. So we're all learning.
It's crazy that healthcare is the only industry in the country that doesn't have an interconnected information technology system.
There is no good reason why the average 7-Eleven uses more information technology than the average doctor's office.
And this is what $100,000 will buy you these days.
It is wrong and it is costly.
We have the best healthcare system in the world, but it failed so miserably at Katrina because of our inability to share information. Patients really were of the impression that because they saw computers in their healthcare setting, that somehow all of the information was in that computer, and wherever you went, that information was going to be available, just like you could go to an ATM and draw money. And that was not the case.
There are days when you get disappointed and dejected because you thought that the argument is so clear. Why aren't these people buying it? And yet people will hesitate and not act and say, we'll do it next year, or we'll think about it next year. And we don't have that much time.
I'm trying to hold on to this dream. I'm able to stay in this world, a sliver of hope that this thing will be resurrected.
This is an evolutionary process. It's not a revolution.
Violent tornado heading into Moore, Oklahoma.
I was able to get onto our systems, and our internal network fortunately stayed up and running.
I think it's really one of the first times that health information exchange played such a tremendous role across such a large area.
How do you not believe it'll make a difference when you put information in the people's hands who need it? So the business-related benefits are huge, but the impact to the patient is potentially undefinable.